Every night while you sleep, your brain is either healing itself or quietly moving closer to a stroke, and the difference between the two might surprise you. It's not about whether you sleep on your left side or your right side. It's something far more common and far more dangerous. I'm Dr. Thomas, and if you're over 60 and watching this video right now, there's a significant chance you're living with a sleep condition that triples your risk of stroke, and you don't even know it. In fact, research shows that up to 80% of stroke patients had this condition before their stroke occurred. Most were never diagnosed. Most never knew they were at risk until it was too late. But here's the good news. Unlike your age or your genetics, this is something you can change, starting tonight. Over the next minutes, I'm going to share what decades of research, including a landmark 2024 study of over 1 million people, reveals about the real connection between sleep and stroke. No scare tactics, no myths, just science-backed information that could save your life or the life of someone you love. By the end of this video, you'll understand the one sleep disorder that accounts for more strokes than most doctors realize, why sleeping too little or too much both increase your risk, the medication mistake that creates a dangerous window of vulnerability, and 5 things you can do tonight to dramatically lower your risk. If someone you care about is over 60, please share this video with them. And if you want to stay informed about protecting your brain health, hit that subscribe button now. Let's begin. Stroke is the second leading cause of death worldwide and a major cause of disability, especially in older adults. While we've known for decades about traditional risk factors, high blood pressure, diabetes, smoking, atrial fibrillation, research over the past 20 years has revealed something surprising. How you sleep matters just as much as how much you sleep. Recent studies show that sleep disorders may account for a significant portion of stroke risk that traditional factors don't explain. In fact, according to research published in major medical journals, certain sleep disturbances can double or even triple stroke risk in older adults. But here's what's important to understand. It's not about sleeping in the wrong position causing a stroke overnight. The real risks are more subtle and develop over time through specific, measurable mechanisms. Sleep affects stroke risk through 3 primary mechanisms. First, blood pressure regulation. During normal, healthy sleep, your blood pressure should drop by 10 to 20% compared to daytime levels. This is called dipping, and it's essential for cardiovascular health. When this doesn't happen, when you're a non-dipper, your risk of stroke increases significantly. Studies show that people whose blood pressure doesn't dip properly during sleep have up to 2.7 times higher risk of stroke. Second, oxygen levels. Your brain needs consistent oxygen during sleep. When breathing is disrupted repeatedly throughout the night, even brief drops in oxygen can damage blood vessels and increase the tendency for blood clots to form. Third, sleep quality and duration. Both too little sleep, less than 5 to 6 hours, and too much sleep, more than 9 hours, are associated with increased stroke risk. A 2024 meta-analysis of 43 studies found that short sleep duration increases stroke risk by 29%, while long sleep duration increases it by 46%. If there's one sleep-related stroke risk factor that's backed by overwhelming evidence, it's obstructive sleep apnea, or OSA. Sleep apnea occurs when your airway repeatedly collapses during sleep, causing you to stop breathing for 10 seconds or more, sometimes dozens of times per hour. And it's incredibly common in older adults. Studies suggest that between 30% and 80% of stroke patients have undiagnosed sleep apnea. Let me share a landmark study published in the journal Stroke that followed 394 people aged 70 to 100 for 6 years. Researchers at the University of Vitoria in Spain wanted to know, does sleep apnea increase stroke risk in the elderly, even after accounting for other risk factors? The results were striking. People with severe sleep apnea, defined as stopping breathing 30 or more times per hour, had 3 times the risk of ischemic stroke compared to those without sleep apnea, even after adjusting for age, smoking, diabetes, high blood pressure, and body weight. Every time breathing stops during sleep apnea, several dangerous things occur. Oxygen levels drop, blood pressure spikes, the heart beats irregularly, stress hormones flood the system, blood becomes stickier and more prone to clotting. Here's what's encouraging. Treatment with CPAP, continuous positive airway pressure, appears to reduce stroke risk. A Spanish study of elderly patients found that those who used CPAP adequately had stroke rates similar to people without sleep apnea. How do you know if you might have sleep apnea? Here are the key signs. Loud, chronic snoring. Gasping or choking during sleep, your partner may notice this. Excessive daytime sleepiness despite spending enough time in bed. Waking up with headaches, difficulty concentrating, or memory problems. Waking frequently to urinate. If you have these symptoms, talk to your doctor about a sleep study. It's not just about feeling tired, it could be a matter of preventing a stroke. One of the most consistent findings in sleep research is what scientists call a U-shaped curve between sleep duration and health outcomes. Both too little sleep and too much sleep are associated with higher stroke risk. A comprehensive 2024 meta-analysis examined data from over 1 million participants across 43 studies. Here's what they found. Short sleep, 5 to 6 hours or less, equals 29% increased stroke risk. Normal sleep, 7 to 8 hours, equals baseline risk. Long sleep, 9+ hours, equals 46% increased stroke risk. Short sleep increases stroke risk by elevating blood pressure and preventing normal nighttime dipping, increasing inflammation throughout the body, promoting insulin resistance and metabolic dysfunction, raising stress hormones like cortisol. While long sleep is more complex, it may be a marker of underlying illness rather than a cause, associated with sleep fragmentation. You're in bed longer but sleeping poorly. A sign of undiagnosed sleep disorders like sleep apnea, related to depression or other health conditions. For most older adults, aiming for 7 to 8 hours of good quality sleep appears optimal, but quality matters just as much as quantity. Here's something many people don't realize. Taking your blood pressure medication consistently is one of the most important things you can do to prevent stroke, especially the nighttime dose if you take medication twice daily. Research published in the American Heart Association journals shows that poor medication adherence is a major contributor to uncontrolled blood pressure and subsequent stroke risk. Antihypertensive treatment can reduce stroke risk by 30 to 40%, but only if you take the medication as prescribed. Most strokes occur in the early morning hours, between 4 a.m. and 10 a.m. This is when blood pressure naturally rises from its nighttime low. If you've skipped your evening blood pressure medication, that morning surge can be even more dangerous, especially if you have stiff, narrowed arteries from aging. Research identifies several reasons older adults miss medication doses: memory issues, multiple medications causing confusion, side effects, cost concerns, depression, complexity of regimen. If you're on blood pressure medication, use a pill organizer with compartments for each day and time. Set phone alarms for medication times. Keep medications visible where you'll see them at the right time. Never stop or skip medication without consulting your doctor. Use automatic refills so you never run out. One missed dose might seem harmless, but in someone with already compromised blood vessels, it can create a window of vulnerability. Here are other sleep factors that matter: alcohol consumption and heavy meals before bed. The research here is clear. Consuming alcohol or large fatty meals close to bedtime affects stroke risk through multiple mechanisms. Alcohol initially dilates blood vessels, then causes rebound constriction, creates blood pressure fluctuations during sleep, disrupts sleep architecture and reduces sleep quality, can trigger atrial fibrillation, causes dehydration, making blood more viscous. Studies show that heavy drinking, 3+ drinks for women, 4+ for men, significantly increases stroke risk, particularly in the hours immediately following consumption. Heavy meals redirect blood flow away from the brain to the digestive system, cause blood sugar spikes followed by drops, can trigger reflux, disrupting sleep, and increase inflammatory markers. So, what does this mean for you? Here are the guidelines that can make a real difference. First, with alcohol. If you choose to drink, keep it moderate. And here's the key: avoid drinking within 3 hours of bedtime. This gives your body time to process the alcohol before you sleep, reducing those dangerous blood pressure fluctuations during the night. Second, your evening meals. Try to finish dinner at least 2 to 3 hours before you go to bed. I know this isn't always easy, especially if you eat late due to work or social commitments. But giving your body time to digest before lying down helps maintain stable blood flow to your brain throughout the night. Finally, hydration. Stay well hydrated during the day, but taper off fluids in the evening to avoid multiple trips to the bathroom that disrupt your sleep. Dehydration makes your blood thicker and more prone to clotting, especially dangerous while you sleep. Now, let's talk about insomnia. Chronic insomnia is independently associated with increased stroke risk, though the relationship is complex. When you consistently sleep poorly, your body experiences elevated inflammatory markers, increased sympathetic nervous system activity, higher blood pressure, and you're at greater risk for mood disorders like depression. If you have chronic insomnia, meaning difficulty falling asleep or staying asleep at least 3 nights per week for 3 months or more, talk to your doctor about evidence-based treatments like cognitive behavioral therapy for insomnia, or CBTI. It's often more effective than sleeping pills and addresses the root causes of your sleep problems. Now, let me give you practical, evidence-based steps you can take right now to reduce your sleep-related stroke risk. Step 1. Get screened for sleep apnea. If you snore loudly, wake up gasping, or feel excessively tired during the day, ask your doctor about a sleep study. This is especially important if you already have high blood pressure, diabetes, or atrial fibrillation. Step 2. Optimize your sleep duration. Aim for 7 to 8 hours of sleep per night. If you're consistently sleeping less than 6 hours or more than 9 hours, talk to your doctor about potential underlying issues that might be affecting your sleep. Step 3. Take your medications consistently. Set up a system that works for you. Never skip doses without consulting your doctor first. Keep a list of all your medications and why you take them, and review your medications with your doctor regularly to make sure everything is still appropriate for you. Step 4. Create good sleep conditions. Keep your bedroom cool, between 65 and 68 degrees Fahrenheit or 18 to 20 degrees Celsius is optimal. Use a supportive pillow that keeps your neck aligned with your spine. Avoid screens for at least 30 minutes before bed, and keep a consistent sleep schedule, even on weekends. Step 5. Address lifestyle factors. Limit alcohol, especially close to bedtime. Finish heavy meals 2 to 3 hours before sleep. Stay hydrated during the day. Get regular physical activity, but not right before bed. And manage stress through relaxation techniques like deep breathing or meditation. Step 6. Monitor your blood pressure. If you have hypertension, consider getting a home blood pressure monitor. Check your pressure at different times of day and share the results with your doctor. This can help determine if your medication timing is optimal for your body's natural rhythms. The relationship between sleep and stroke is real, it's significant, and most importantly, it's modifiable. These aren't dramatic changes. They're sustainable, evidence-based strategies that can genuinely reduce your stroke risk. Remember, good sleep isn't just about rest. It's about giving your brain and cardiovascular system the conditions they need to stay healthy. If you found this video helpful, please like, subscribe, and share it with someone who might benefit. Leave a comment below letting me know what topics you'd like me to cover next. Thank you for watching, and as always, stay healthy.